Welcome to part 4 of module 2. At this stage, you are now familiar with the bones of the actual skeleton. Let us now move to another topic, which is the anatomy of the appendicular skeleton. In particular, this presentation is specific only on the bones of the thoracic limb. At the end of this lecture, you should be able to identify the names of the bones of the thoracic limb as well as their specific parts. The appendicular skeleton is grouped into two: the bones of the thoracic limb or front limb, and the bones of the pelvic limb or hind limb. The bones of the thoracic limb includes the scapula, humerus, radius, ulna, carpals, metacarpals, and the digital bones. In this presentation, we will discuss them one by one. Before we start with the bones of the thoracic limb of dogs, let me introduce one bone that is also considered a part of the thoracic limb and of the pectoral girdle. This is the clavicle. It is a collar bone that articulates with the shoulder and the sternum in man. Clavicle is absent in most domestic animals. In dogs, this bone is reduced as a tendinous intersection of the brachiocephalicus muscle. This bone is present in cats and should not be mistaken for a bone in the esophagus on a lateral radiograph. The scapula is a flat triangular bone of the shoulder joint. The scapular spine is a long projection dividing the scapula's lateral surface into two fossae. The supraspinous fossa is the area cranial to the scapular spine for the attachment of the supraspinatus muscle, and the infraspinous fossa, which is the area caudal to the scapular spine, for the attachment of the infraspinatus muscle. The expanded distal end of the scapular spine is called acromion. On the medial side of the scapula, we can see the subscapular fossa for the attachment of the subscapularis muscle. The dorsal part is serrated for the attachment of the serratus ventralis muscle. The glenoid cavity is a shallow cavity articulating with the head of the humerus. Supraglenoid tubercle is a process near the cranial aspect of the glenoid cavity for the attachment of the biceps brachii muscle. On the other hand, the coracoid process is a small process on the medial side of the supraglenoid tubercle for the attachment of the coracobrachialis muscle. Now let's move to the bones of the arm. This is the humerus. It is the largest bone of the thoracic limb. It articulates proximally with the scapula, forming the shoulder joint, and with the radius and ulna distally forming the elbow joint. The head of the humerus is a round process at the medial side of the bone, articulating with the glenoid cavity of the scapula. The greater tubercle or the lateral or major tubercle is a large process craniolateral to the head of the humerus. This is the point of the shoulder. The lesser tubercle or the medial or minor tubercle is a process at the medial side of the head. The bicipital groove or the intertubercular groove is a sulcus between the greater and lesser tubercle through which the tendon of biceps brachii runs. The body of the humerus or the shaft connects the two extremities or epiphyses of the humerus. Once the shaft is touched, you can feel a roughened bony projection. This is the deltoid tuberosity, a large tuberosity at the lateral side of the humerus. It can be best seen at a lateral view. The entire distal end of the humerus is termed as humeral condyle. Lateral epicondyle or the extensor epicondyle is present at the lateral side of the humeral condyle, giving rise to the extensors of the forearm. On the other hand, medial epicondyle or the flexor epicondyle is located at the medial side of the humeral condyle, giving rise to the flexors of the forearm. Olecranon fossa is a caudal excavation at the distal end of the humerus, while the counterpart radial fossa is the cranial excavation at the distal end of the humerus. This opening is the supratrochlear foramen. It is a hole between the olecranon and the radial fossa. Take note that no structures pass through this foramen. Let's move to the bones of the forearm. This is the radius and ulna. And this is the shorter and more massive radius. It is located medially. It is the weight bearing of the forearm, meaning it carries the force when the animal is standing in a normal position. On the other hand, this is the ulna. It is longer and slender compared to the radius. It is located laterally. Let us discuss the parts of each bone. The proximal end of radius is called head. The body is called the shaft, and the pointed distal end is called the medial styloid process. As mentioned, the ulna is longer and the slender bone of the forearm. Mostly, the function is for the attachment of muscles. The proximal end is called the olecranon process. This acts as a lever for the attachment of extensor muscles of the forearm. This is the point of the elbow. The trochlear notch or the semilunar notch is a crescent-shaped concavity at the proximal end of the ulna, which articulates with the distal end of the humerus. The trochlear notch is bounded by three processes that is formed like a triangle. Here is an enlarged proximal end of the ulna on a lateral and cranial view. An conial process is a beak-like projection at the proximal end of the trochlear notch. The medial and lateral coronoid processes are the large distal end on the trochlear notch. Note that the medial is larger than the lateral. The distal end of the ulna is called the lateral styloid process. The interosseous space is the space between the radius and the ulna. Now let's move forward to the bones of the distal thoracic limb. It includes the carpals, the metacarpals, and the digital bones. First, we have the carpals. This is the bone of the wrist. The carpus is a complex region that includes 2 rows of small bones. Each row is composed of 4 carpal bones. For orientation purposes, let me emphasize that this is the medial side and this is the lateral side of the animal. In naming the bones, we start from the medial to the lateral. The upper boxes are part of the proximal row, while the lower boxes are part of the distal row. Carpal bones at the proximal row are called radial carpal bone, intermediate carpal bone, ulnar carpal bone, and accessory carpal bone. On the other hand, those at the distal row are numbered from 1 to 4. So we have the first carpal bone, second carpal bone, third carpal bone, and the fourth carpal bone. This is the general arrangement of the carpal bone. However, in dogs, there is a modification. The radial carpal bone and the intermediate carpal bone fuse, forming the intermedio-radial carpal bone. Schematically, here is the arrangement of the carpal bones of dogs. The intermedio-radial carpal bone is located at the medial side of the proximal row and is the largest carpal bone. The ulnar carpal bone is the lateral bone of the proximal row. The accessory carpal bone is a truncated rod of bone located at the palmar side of the ulnar carpal bone. Here is a lateral view of the carpal to show fully the accessory carpal bone. Now let's discuss the bones of the distal row. The first carpal bone is the smallest carpal bone. The second carpal bone is wedged shaped. The third carpal bone is larger than the second carpal bone, while the fourth carpal bone is the most lateral and the largest carpal bone of the distal row. We move to the metacarpals. The generalized pattern of metacarpus is 5 bones number from 1 to 5 from medial to lateral. This is metacarpal 1 seen at the palmar side, and it is the shortest among the 5. Here is the metacarpal 2, metacarpal 3, metacarpal 4, and metacarpal 5. Each bone is composed of a base, a body, and a head, which articulates with the proximal phalanx of the digit. Each digit contains one dorsal sesamoid bone seen at the dorsal surface and two proximal sesamoid bones seen at the palmar surface. All of them are located at the proximal interphalangeal joint. For the digits, except for metacarpal 1, each metacarpal bone has a corresponding 3 digital bones. Phalangeal bones include the proximal or the first phalanx, middle phalanx or the second phalanx, and the distal or the third phalanx. Here is an enlarged image of the distal phalanx. Ungual crest is a crescent-shaped shelf of bone at the lateral and dorsal base of the ungual process. Meanwhile, the ungual process is a laterally compressed cone at the distal end of the phalanx. This is shielded by the horny claw. And that ends our lecture on the remaining parts of the first half of the appendicular skeleton. You are now almost at the end of Module 2. I hope you are now able to recognize the bones of the arm, forearm, carpus, manus, and the digits. To assess your learning, a short quiz is prepared for you to answer. After that, you may now proceed to Part 5, the last part of Module 2, which is the bones of the pelvic limb.